As you have seen, we started the recording, so the session will start. Welcome to the German WASH Network's WASH session. It's a pleasure to have so many people virtually joining here. We will talk today about, we let experts talk today about the topic of anticipatory humanitarian action. As you might know, this whole WASH session is an event that we do as the German WASH Network repetitive. So we have more than just this session, more on this later. But it's a pleasure to have it again. It's a pleasure to have my colleagues Arno Kuver from Malteser International and Sebastian Kunze from Sign of Hope with me. My name is Lawrence Evers. I work for Archinova, and today the three of us will guide you through this event. We have quite a lot of interesting speakers that will bring you a bit closer to the topic of anticipatory humanitarian action. We, as mentioned, as Sign of Hope, Archinova and Malteser International are part of the German WASH Network, and we are also part of a consortia project. So this whole WASH session event is brought to you by this consortia project, which is financed by the German Federal Foreign Office. So thank you for financing this event, and thank you for supporting this WASH network. We are also want to thank the Global WASH Network for supporting us, for spreading the word, for inviting more guests, especially the Climate Working Group. But they will have a session in between as well, so you will hear from them. With this being said, I think this is the most crucial part. I will try to hand over to my colleague Arno. Arno, can you hear me? Can you continue?
I can hear you. Yeah. Okay. Thank you, Lawrence. Yeah, my name is Arno Kurver. I'm sorry, my video is just not working this morning, so I can only link in here by audio. Yeah, anticipatory humanitarian action. It's in fact a very interesting topic for us as the German WASH network. That's why we also wanted to learn a little bit more about it, exchange on it. And more or less it's linked to the, if you look at the whole humanitarian sector, the activities in the humanitarian sector, we have noticed that there are more and more hazards linking to disasters, be it natural disasters, but also when can consider conflict on one hand. But on the other hand, also there are not a lot of developments like improved early warning systems, risk analysis and planning, and other resources that are there that have led to more or less a more effective way of dealing with humanitarian aid through anticipatory humanitarian action, more or less trying to mitigate the impact of impending disasters or crises before they occur. And this is in contrast with traditional more reactive humanitarian responses that we are typically used to. Although also in previous responses, there was a lot of emergency preparedness, but that is not as detailed as we found out of, as we can see, also learn from this webinar, as the anticipatory humanitarian action. So that's why we have invited the experts in this field of anticipatory humanitarian action to learn more about it and to see how can we implement it, how can we apply that for our WASH sector. And so, yeah, in general, I think, yeah, we will look at the key elements of anticipatory humanitarian action that are, yeah, the early warning systems, but also with a lot of forecasting tools to predict potential disasters as floods or droughts that are very important also to know for our WASH sector, because WASH is also in many of the emergencies or humanitarian interventions, and WASH is a key component that to look at. Then, yeah, risk analysis and planning will also be looked at. Is assessing the vulnerabilities and planning interventions based on predictive data to address the specific risks. And then, yeah, elements of the anticipatory humanitarian action are also the pre-positioning of the resources, and very importantly also the financial instruments to establish funds to ensure, and insurance mechanisms that we can quickly activate if needed to prepare for the disasters. And all activities, of course, very important to have the strong community engagement. If we look again at the wash sector, which is our topic of today, why is anticipatory humanitarian action so relevant also for WASH humanitarian players? That is more or less the key or the topic of our webinar today. Yeah, in fact, we can see for WASH, we often be working in the field of preventing waterborne diseases. So if we can anticipate floods and droughts, then we will be in a far better position as WASH player to implement such measures, and it can be pre-distribution of water, purification tablets, or setting up emergency water supply and other things. Yeah, ensuring of continuity of services is also very important if you look at the wash sector. And early actions can protect water and sanitation infrastructure if disasters strike. Then improving the resilience, so that with anticipatory actions we can help build the resilience of the communities. Then the efficient resource utilization, and then yeah, we also will look at reducing health impacts. In fact, all these factors will be addressed in the examples or by the speakers that we have invited for this WASH session. We have more on general also on the anticipation hub. They will present their activities on advancing and sensitizing agencies on this methodology. We will have an example also from Malteser International on a study that they did on how anticipatory humanitarian action could be part of their work. And then we go more in detail also from field-related examples on cholera related interventions in the DRC via the Global WASH Cluster UNICEF. And we will look at flood-related actions required for in Bangladesh with Welthungerhilfe. And then also, yeah, we will hear from the German Red Cross on activities that they are planning in this field of anticipatory humanitarian action. So all in all, we can say very important for our WASH sector. And yeah, we are, as a German WASH network, keen to learn and to exchange and to follow up on this methodology. And yeah, I wish you all a very fruitful webinar on this topic. I would like now to invite my colleague Sebastian to give a little bit more information on the program itself, on the technical aspects, on how we are going to manage this webinar. Thank you very much.
Yes, thank you very much, Arno. So good morning, everyone. Pleasure to be here as well. My name is Sebastian, and as Arno already gave some insights or presented the agenda for today, you can clearly see that we have like a broad area, comprehensive package of anticipatory action. The first part will be like rather, you know, in general about anticipatory humanitarian action. And after the short break of 5 minutes, we are going into the details, into certain projects and so on. So I think we have a very exciting agenda for today, a lot of very good guest speakers, very interesting. And yeah, let's all enjoy this session. Before we start, some technical matters. I'm not going to talk about the usage of Zoom, don't worry. But as you can see, we have a tight schedule. We are quite a number of participants in this round. Up to now, there are above 100 people. So asking questions, we would kindly encourage you and ask you to put the questions in the chat. Also related to the tight schedule, we can of course not answer all questions. After each presentation, we will probably pick one question that is related to the question that was to the session that was just presented. Pick this one and then answer this one. All the other ones will later, either in the last session, in the Q&A session, or we will provide you with a document in which all the questions are being collected and answered, and this will be shared afterwards. So furthermore, the presentations that you will see will be shared afterwards. And also, I think you have already seen it, but the session will be recorded or is already recording. Lawrence mentioned that in the very beginning. So yes, I would say let's not talk much more and take much more time from the great guest speakers we have today. So I would basically already hand over to the next or to the first session. And we have Karen from the Anticipation Hub, or the Red Cross, basically. She's the technical manager for Anticipatory Humanitarian Action. And we have Matthias from the Welthungerhilfe. He's the team lead, Anticipatory Humanitarian Action and Networking. Good to see you. Welcome. Good morning. I'm happy to have you here. Over to, I would say, the two of you. Karen, happy to invite you.
Perfect. I guess I'll take over for now and then hand over to Karen in a second. Thanks a lot for inviting us. Thanks for Lorenz, Sebastian, and Arno for the great introduction to the topic. That actually leaves me with a little less in the first slide, so that's useful. I don't know how we do it. Will you be sharing the slides?
If it would be possible, if that you can share the slide, that would be easier for us.
I can try to do that.
You should be co-host, so you should have that possibility.
Sorry, one sec. Can you see something already?
Yes, we can see your presentation.
But not in the full screen, right?
Not in the full screen, yes.
Now?
Perfect.
Perfect. Very good. So as you introduced us, I'm Matthias from WHH Welthungerhilfe. I'm our team lead for Anticipatory Action. So I will join Karen from the German Red Cross and part of the Anticipation Hub to give a little introduction into the topic of anticipatory action. We'll start with a cartoon. We like to start with cartoons. And this cartoon, you can read it as a climate change cartoon, but you can also read it as an anticipatory action cartoon. Basically, we sometimes know what will happen. We discuss what will happen, but we have a history of many, many years where we did not really act ahead of the things happening. And when you look at this picture here, you see that if we don't act, there will be damage done. And a rapid response that is typical what we do in humanitarian action is not actually the same. Yeah, I mean, we can do a rapid response, but we will not save, we will not prevent this thing from happening. So that's a bit where we are standing. We are getting better and better in actually having good predictions, having good forecasts for a number of particularly extreme weather events, but also other hazards. We could do something, but we somehow need some ingredients to actually be able to do so collectively. And about these ingredients and about the concept of anticipatory action, we will talk a bit in the next 15 minutes. And that's already where I hand over to my colleague Karen. That's beautiful.
Thank you, and thank you for laying the ground already, Matthias. So I would counterintuitively like to start on the right side of that slide. So we see here some figures from the World Disaster Report of 2020 that was published by the IFRC. And what you can see here is that between 2010 and 2020, we can see that 83% of all disasters were caused by extreme weather and climate-related events. So we see that many of the disasters that we try to address in response are actually caused by weather and climate-related hazards. And what we also see with climate change is that, even more in the future, that there's like a 35% increase of the number of climate and weather-related events. And that, of course, means that more people are being killed by extreme weather and climate-related events, that are more people being affected. And I mean, that's only going to grow in the future. So that gives us a big challenge. On the other hand, and that's on the plus side at least, we are getting better in forecasting. So I would like to draw your attention to this graphic, and don't be scared, on the left side. I want you to first look at the graph, at the purple graph that is on the very top. So basically what you see in general in this graphic is the accuracy of forecasts in the example of cyclone forecasting. So what you see is the track error. So how was the track of the cyclone forecasted at a certain, like different lead times, so different forecasting periods. So if you look, for example, at the 72 hours, how much was the track error, how big was the track error 3 days before the cyclone made landfall in the 1960s? And we can see that it's actually more than 400 miles. So it's really difficult to know where exactly the cyclone is going to hit. And we're not even talking about intensity here, but we're only talking about where is the cyclone going to make landfall and which communities are going to be affected. Now, with advancements in technology and forecasting, we can actually see now, if you look at the graph at the very bottom, like the lowest one, we can see that the track error has decreased immensely. So now with this advancements in technology, we can actually more and more know what's going to happen. Where is the cyclone going to make landfall? Where, like, with what intensity is it going to hit on land? And that gives us a lot of information. That gives us information that we didn't have 50 years ago and longer. It was simply that we couldn't act in advance because we weren't really sure what's going to happen. So this is basically the idea also of anticipatory action, right? To use this information and ensure that we do something with the knowledge that we didn't have before. Let's move over to the next slide, please. Matthias, can you? Here we go. Okay, wonderful. I know that everyone every organization in this call might have their own version of this DRM continuum. I'm going to use this one now, and you can debate with me later. But it's just basically to show you a bit the timeline and where anticipatory action sits in the disaster risk management continuum. So if we're basically going from the very left, so from the phase of the mitigation, where we really try to mitigate risk from the very beginning, moving to the preparedness phase where we try to develop the capacities and set everything into place to ensure that we can effectively anticipate and manage emergencies from basically anticipatory action to response. But this is all basically mitigation, preparedness. It's all way before a specific event. And now we come to anticipatory action. So here, once a certain trigger point or an early warning comes in, this is when the anticipatory action starts. So when the forecast indicates us, look, there is Cyclone Freddy that's going to make landfall in Mozambique in 3 days from now, or like the Cyclone Beryl that we've seen in the Caribbean. So this is like, once this is forecasted, once we can see the event on the horizon, this is where anticipatory action comes in. But it's before the actual impacts are felt. So this is, and the time we have in between, so basically between the early warning and the actual event, that's what we call lead time. And this is the time in which we implement our anticipatory actions with the aim to actually reduce the impacts before they even occur. And then from that, we would move into a response phase that can be a very early response phase that is already informed by the forecast and by the anticipatory actions that have been taken place. And from there, we move into the recovery. But again, this anticipatory action, it's not so long-term in that sense. Of course, you need preparedness in order to implement anticipatory action because you need to have all the systems in place. But it's only in that little window of opportunity that opened up because now we have the forecasting that is available. Next one, please. And handing over, actually.
I take over and unmute myself. Perfect. Thanks, Karen. Now, basically, we are taken out of this continuum that you showed to us. We take out and focus on anticipatory action itself, take out some of the elements you described and look at what we came up as a community with definitions and parameters for that. basically, the definition again will be something, we have different versions of that already, but it is very similar in the main elements. So the idea is that we take actions that can prevent or mitigate. So that's a key element of that. And we should use forecasts. We should act ahead of a disaster, or sometimes where it's not very clear, like in a drought, where does a disaster actually start? Where does it end? It's ahead of some peak impact. So the time where we can still mitigate, remember the bus, yeah, we need to act early enough so that we can mitigate and not only respond. This works best, we found, when we have some things pre-agreed. So we need to agree actually where is the point, where's the trigger, where's the point where we want to start, where is who is doing what and with what funding. The parameters that we agree to is the reducing and preventing when possible, reducing or mitigating otherwise, acting ahead, but also taking these decisions based on some kind of forecast or collaborative analysis. We'll come to that in a bit time on the different, let's say, versions of anticipatory action there are around. Now on the right side, you see some of the benefits that we have. We are obviously faster. That's clear. We have a different quality of actions that we can do. We are, and that is what all our evidence up to now shows, we are more effective. So what we do just leads to more impact, but we are also more efficient. That's something that we usually like also to tell our donors, because we are in a time where we have limited funds for a lot of needs. So if we can use every dollar, every euro in a more efficient way and reach more people, protect more people, this is something that is very useful. But having said all that, the most important, I would say, is on the very right side, it's more dignified. So you can imagine if we have the possibility to support people in acting ahead of something, some harm coming their way, something is happening to them, it's a much different way. It gives much more capacity back to people that they can actually use this time window by getting cash in advance, by getting goods in advance, and acting to protect themselves and to support positive coping strategies. So this element of a locally led anticipatory action that's more dignified, that's very important to us. There's one more box here around the G7 foreign minister statement that was last definition taken basically by all the major donors. You can see not much difference. So acting ahead of predicted hazards to prevent and reduce acute humanitarian impacts before they fully unfold. There's another process going on in the grand bargain where, again, we want to reaffirm this kind of definition, but in a bigger group of people, not only donors, but also including the UN, including the Red Cross, Red Crescent movement and NGOs. That's upcoming, and we can look forward to that sometime in October. Now, if I said it's more effective, so that's about the impact and efficient. We have usually used one of these graphs produced by OCHA, but also like in the graph before on the DRM cycle. There are a lot of different ways how to picture that, but it's relatively easy to understand here. If we have the possibility, I mean, the traditional response is the orange line. We had something coming, shock, there are needs, we respond. It takes some time and it's usually relatively costly. If we now can take the blue line, we use the yellow trigger for the activation, we can act ahead. Then the whole cost, the whole need for, or the needs that occur and the cost that we need for responding or acting ahead of that is just less. Even if we include the rapid response that we will still need after that. So we reduce the losses and suffering and have a more effective and efficient response. Very easily to understand as well with a nice picture down there about the sunscreen and the after sun, even though always careful with numbers. I think many of you have been in the sector for long. Many of you know the DRR that has been there even far before the anticipatory action. DRR likes to say $1 invested is worth $7 in less response. We cannot find these numbers in the same way all over, but that's very clear because we have very different hazards, we have the very different contexts, so it cannot be always the same number. Donors like to hear one same number, but what we can say is all the evidence says it is much better. Sometimes it's 1 to 2, sometimes it's even 1 to 30. It depends a bit on what you count in, but certainly it helps us to act ahead. Now, as I said, there are different ways of doing anticipatory action, different decision mechanisms. Some are more trigger-based, meaning we have relatively quantifiable numbers of the probability of an amount of rain falling or not falling, of the probability of a cyclone making landfall at the specific place, the probability of heat reaching a certain level or cold. All these things we can model and we can basically put into a trigger system. That's one way of doing anticipatory action, and that is used a lot by the early action protocols of the Red Cross or also WHH. But also we can do anticipatory action based basically on a decision of people. Yeah, if we can see something is coming and we have the time, we can also decide just to act. We would always say we also count that as anticipatory action. Wherever we can pre-agree on triggers, it's better, it's faster, but when we cannot, it's still good to act. So that's something that, for example, the START network with the START Fund is often doing, to say, okay, we can make a decision now because we see this or that coming. And these can be things like violence after an election or something like that. That is not easy to model, but we can still sometimes predict it. So different ways of doing that. We have different systems that are funding anticipatory action. For the Red Cross, it's the Disaster Response and Disaster Response Emergency Fund. For the, you changed the name, sorry, it was Relief at one point. Then for the START network, we have the START Fund that I mentioned, but also START Ready, that is more trigger-based. For the UN agencies, the Central Emergency Response Fund, but also there are options you might have come across these days. For example, in ECHO proposals, you can build in a crisis modifier these days that would also allow you, under certain circumstances, to use money in the crisis modifier for anticipatory action. And there are many other things, like municipalities basically also taking some of the learning and taking anticipatory action in their disaster risk management frameworks. So you can see different ways. In the end, it's all about acting ahead and using this advantage to have the time and the money and the agreements ahead of time. Many different actors. You can see now some of the NGO, us, some of the Red Cross, but we also have WFP and FAO and OCHA very actively engaged in anticipatory action. And what's always been the case, we need different, like the governments need to be part of that, the local authorities. We need academia to support us in getting better in the predictions. And we need to reach out to the development actors as well as some of the conflict actors to see how we can basically also cover the HDP space in that. And that's already where I hand over back to Karen.
Thank you, Matthias. Yeah, as you have just also described, I mean, the definition of anticipatory action doesn't necessarily say that everything is pre-agreed. Although, when you think about especially fast onset hazards, it's really recommended to pre-agree some of the components of what you want to do in anticipatory action. So when you think about, simply because you don't have so much time, right? If you have 3 days before a cyclone, ideally you have agreed on different, on the different components of how your anticipatory action would look like, simply because otherwise it will be very difficult to implement. That might be different for other hazards. I mean, drought is one of the examples. I think many agencies triggered of last year's El Nino-induced droughts simply because they knew, okay, this is going to come, and now we can basically set up a plan, but simply because they had more time. So what would components of an anticipatory action plan, where basically everything is pre-agreed, how would they look like? One thing is certainly the trigger. So that is the predefined threshold of this parameter that you're looking at. So if you're, for example, looking at the standardized precipitation index for drought, or you're looking at the cyclone wind speeds, is it, would you trigger at 120 kilometers an hour or 160 kilometers an hour? Is it a certain flood level? And usually you would establish that trigger based on, for example, an analysis of historic disasters, so disasters in the past from which okay, this has had like a disastrous impact in the past. So this is why we would set a trigger at a certain level. And the trigger then basically helps you in understanding when and where early actions or anticipatory actions are going to be implemented. So the when is like, okay, the cyclone is making landfall in 3 or 4 days, and the where, okay, we know where exactly the cyclone is going to hit or where we're expecting major floodings. So that is when you pre-agree basically the trigger. And the second thing is the early actions themselves. Because if you basically define them before, I mean, that will also help you in implementing them faster. So if you, if then the trigger is reached, you implement the actions that you have already pre-agreed, where ideally, you have already pre-positioned the items that you want to distribute, you have trained your staff and volunteers or with whomever you're working, so that the actions can be basically implemented very smoothly. And then the third thing, and I think that is something also where we fought as the anticipation community a lot at the very beginning, is the financing mechanism. So this automatic allocation of funding, or at least the allocation of funding that is pre-agreed and secure. Because ideally, I mean, it's always, I mean, these processes take time usually to get funds in country and so on. But if you, wherever it comes from, if it's in an ECHO proposal as a crisis modifier, if it's in, if you have, as we in the Red Cross have the draft where we can really pre-agree funding, I mean, I think it just helps to know once you trigger your actions where the funding is coming from. And I think this took really a big mind shift also in the donor landscape to basically open up and say, okay, we're going to finance something that has not happened yet. So I think this is a really big achievement of the community, but it's really important to think about, because how else are you going to basically fund your activities? And then the last one that is a bit grayed out here, because this has to be thought through in more general, is this delivery. So what is your capacity to implement the action as planned? Because you, of course, can make lots of big plans, but then when reality kicks in, can you implement all of this? Do you have the capacity? Does your financial service provider, if you want to distribute cash, have they done this before in this short of time, and so on? So there's a lot to basically rethink when we talk about anticipatory action. Not undoable, but just to think about. And the next one. Perfect. So what I would like to briefly show you is one example of how you can develop an anticipatory action plan or anticipatory action framework. This is like a bit of a standardized timeline that we use in the Red Cross, but I think every agency has adapted it to their own uses or has their own version of it. I will just like to show you ours. So here, what you can see is we usually start, in many cases, and we will hear about that from Rebekka later, is that we would also start with a feasibility study. So when we start, for example, in Mozambique, to see, okay, what are the hazards that are important, what had major impacts, to basically understand more, okay, where do we actually start with anticipatory action? That's not on this chart here, but just to say that a study can help in shaping this from the very beginning. But then the first step would actually be understanding and prioritizing the risk. So here we look at, okay, if you want to work on floods, then at this point you want to understand, okay, what has been the impacts in the past? Who was mainly affected? Why were they affected? And how were they affected? So basically understanding, basically doing the whole risk assessment and really understanding, okay, what is it that we're actually looking at? And then this prioritizing risk is also important, because realistically, you will not be able to address all the impacts and all the risks in your anticipatory action framework. Most likely, you will need to pick some, and that will then also help you in designing the rest of your anticipatory action plan. Then you have usually the process of the identification of forecasts. So you would look at, okay, what kind of forecasts are available in my country? What does the weather service offer? Is there any other global forecast I can use? So you would basically go on a bit of a hunt to find the most suitable forecast for your purposes. And I mean, it can be very different, right? It can be weather service, it can be if it's really local level. For example, in the Philippines, we know that people upstream are calling the people downstream if the water level reaches a certain threshold. It can be as simple as that, but it needs to be a somewhat established system that tells you also how many false alarms will you have? Like, how good is your forecast? Because what you want to avoid is to, you know, is to have forecasts that are always wrong, simply because of, you know, reputation, trust in the system. So you want to also ensure that you have something that is really, yeah, fulfilling the purpose. And then once you have identified your forecast, more or less, you would then overlay this with your risk assessment and then define these impact levels. So basically defining this threshold at which you want to act, defining that flood level, defining that wind speed, and so on. And then, I mean, you would select your early actions, you would design them. Ideally, you do this in a, you know, very participatory manner where you involve, of course, the communities that are mainly affected and I mean, of course, that also means you need to talk to maybe the governments because some actions might not be allowed. So there's lots of stakeholder engagement in the whole process. And then you would write this up into your anticipatory action plan, or how we call them, early action protocols. You can then think about the financing mechanisms, so who's going to finance it. And then you monitor forecasts. Once the trigger is reached, you would activate your anticipatory action plan, implement your early actions. And then on the very right, you see another bulb there that is the evaluation and lessons learned. And we have, you know, anticipatory action is still a baby when you look at the whole humanitarian world. And I mean, we're like 10 years old, so there's still a lot to learn and to be shared in that regard. So that's, I think, one of the main points we also always want to make, that, please learn from your activation, but also share the lessons learned, because we are all, we all still need to learn a lot. Over to the next one. I just said it already. I mean, as we said, anticipatory actions itself is activities that are carried out based on a warning or a trigger ahead of the crisis impact. But if we think about especially the plans, and when we talk about the the fast onset hazards, then it just makes sense to think about some of the enabling activities. So that means that there are that you can think about, okay, some readiness activities. That means once you have identified all your early actions, basically your plan is done. It's, you know, signed off by all the stakeholders. But then to think about, okay, if it's not going to be activated in this year, but only in the next year, how do I ensure that all the stakeholders involved are still ready and they know what needs to be done once we activate, right? That's a bit the tricky part about anticipatory action, because you don't know when this is going to happen. So you might want to include these, what we call readiness activities or preparedness activities, where you do trainings, you do refresher workshops, you do all of this in order to ensure that you're ready to activate. And the second thing would be the prepositioning of stock, because again, right, you don't want to start prepositioning things for an event that happens in 3 days. So ideally, you do all the procurement and things before. That can be very handy, especially for the fast onset hazards, because it just gives you more time. Yeah, and I just want to do one short link to integrating WASH into anticipatory action. So I just wanted to highlight here the working group on anticipatory action and health on the Anticipation Hub. And you see the co-leads on the right side here, and maybe you can click again, Matthias. Perfect, because they have one of the outputs from last year was this position paper, or like a briefing that basically outlines a bit anticipatory action specifically for epidemics. Maybe click one more, Matthias. And here we are looking at basically different approaches of how we can do anticipatory action for epidemics. For example, health impacts that are linked to hydrometeorological hazards. There's a second approach that they call a composite trigger, where they basically combine surveillance data and other factors. And of course, then the third one, like the mathematical models, where you basically model an outbreak itself, where you don't include surveillance data. I would really recommend to visit the working group page. I can put that in the chat just after that. So yeah, because they are working, I mean, not specifically on WASH, but on health overall, and with a specific focus on epidemics. And over to you, Matthias.
Perfect. Taking over again. We were tasked to give you an overview of anticipatory action, which is actually a challenging thing in 30 minutes. We are realizing again. But what we want to do as well, next to the definitions and concepts, is just to show you a little bit where this is happening. And we are very happy to tell you that it's growing. It's a growing thing. And we have here the map that is part of the global overview report. And I do recommend to all of you interested, just take a look at that and read it, not the map, but the report itself. There's it's not too long, but there's a lot in it, and we will not be able to go into any detail on that. But what you can see on the map already is many countries, particularly around Asia and Sub-Saharan Africa, are doing anticipatory action, as well as the key. I don't know if you can read it, but you can see there are many different hazards that we are looking at. So it's really growing in the number of hazards addressed by anticipatory action. It's growing in the number of countries. The next slide, if it comes up, shows you that currently we have 47 countries with active anticipatory action frameworks or protocols. I would even say this number is lower than the countries where we are somehow active with anticipatory action, which is 70 plus. So in more than 70 countries, there has been anticipatory action in one way or the other, but the report itself looks only at what's active right now or in development right now. Apart from that, what's telling for me a bit is we are really growing the number of frameworks. So from last report for 2022, 70 to now 107. But at the same time, you can see on the right side, we are growing the pre-agreed financing for anticipatory action, but not to the same level. Yeah? We had in 2022 138 million pre-agreed for anticipatory action. Now this last report shows 148, 10 million more, with 37 plans more. It's not really catching up, so we really need to make sure to advocate for more funding for anticipatory action, particularly also for more fuel funding that helps us to activate the plans when the trigger hits. What are some of the achievements? We reached more people, cover more geographic areas, as you saw on the in this map. We also getting better in mainstreaming anticipatory action into other systems, which is very, very important. So the disaster risk management in countries, but also the links to climate change adaptation and how anticipatory action can play a crucial role in that. We are getting better to really to make that link. Also using other systems that are existing, like social protection mechanisms, and by integrating anticipatory action, make them more shock responsive. We apply to more types of hazards. I told you in the map already, and the funding is increased, even though it's not as much increased as we want. So there's always also the possibility to try to link anticipatory action more to development and climate finance. We'll see where we are getting with that. Now I see this is already up to Karen again, because Karen has the Anticipation Hub background. So I'll let you take that one.
Ta-da! Wonderful, thank you. Okay, so yeah, I just wanted to briefly give you an overview of what is the Anticipation Hub. So the Anticipation Hub is basically your one-stop shop for everything about anticipatory action. So what we try to do as the Anticipation Hub is to be a platform to facilitate knowledge exchange, learning, and guidance and advocacy around anticipatory action, supporting all the different actors in anticipatory action, which are of course practitioners, but also the scientists that help us with the forecasting and more, and the policymakers. So the Anticipation Hub is really the place where we all come together, both virtually and in person. So what you find there is like learning resources. So there's, for example, an early action database where you can filter early actions that are, for example, related to health. you find a global project map. So we try to convince all the stakeholders in Anticipatory Action to put their projects on a map, so that you can also see, if I start a new project in Mozambique, okay, great, there's already this and this type of actors that are doing these and that activities. We've seen that, yeah, there's different working groups, the one on health, there is the linking risk finance to anticipatory action, there is one on monitoring evaluation, so there's lots of different working groups. We also host, of course, the dialogue platforms on anticipatory action, regional ones, and the global one that happens each year in Berlin. And we have a newsletter, which I invite you to sign up for, with latest blogs, news, events on anticipatory action. So yeah, please join us in this global endeavor. And I think with that, we are closing, and thank you very much for your interest and time.
Time is up. If you want to reach out to us, I think we will stay in the call for a bit. I have to leave in between, but come back. Karen will be there. You have our names here, and that's it. And we don't have time for questions now, but either in the end of the day, I think, or some of the sessions, or if there are open questions, you can also find our mail contacts, as well as our Anticipation Hub and Vahafa, which is a WHH project that I did not even talk about, but if you want, reach out to us. And thanks a lot for your attention.
Yeah, thank you very much, Karen and Matthias. Thank you also for being there for open questions or for questions later. I think there was one open question from Alexandra already in the chat. I think especially for Karen, it's quite interesting to answer maybe that later or in the chat. Yeah, thank you for taking on the challenge to present this whole, or give us a starting point into this whole sphere of anticipatory humanitarian action within 30 minutes. As Karen already mentioned, one of the crucial things to start with is a feasibility study. So it's a pleasure for us to welcome Rebekka. I will try to highlight Rebekka, and I will ask Rebekka to tell us if you are able to share the screen with your presentation or not.
Thank you so much, Lorenz. Thank you for the warm invitation. Indeed, I'm not able to share right now because I just had to switch laptops last minute. So I would be very grateful if you can share from your side.
Of course, I will take over, replace current share. We'll try to share the presentation. So if I need to switch to the next slide, please tell me. Now it's...
Yes. Yeah, now we have it done.
Is it full screen now, or is it now the wrong one?
Presentation mode. Now it's full screen. Keep it
Perfect.
like this. Brilliant. Thank you so much, saving my day here. We have okay, bit over time, but I will try to keep it short and quick and give you an overview of what we did. So thank you so much again for inviting us to the call, Malteser International, and for having us in this exact slot, because indeed, I believe it fits very nicely to what Matthias and Karen have shared with us. If you've never heard about anticipatory action before, or you heard bits and pieces, then you might be at the very same place that Malteser International was at last year. We heard a lot about external actors. We became part of the hub. We became interested in the STAR network and into donor funding. But we were at the very beginning on our journey with anticipatory action. And this is where we started to conduct feasibility study. And here I would like to share a little bit to you. Yeah, you can jump to the next slide. What we did, I keep it short and sweet on why we did it, how we did it, and what are our findings. Sort of as not going much into detail, because all these technical terms you've just heard from Matthias and Karen, I think are confusing enough. So this is rather a sneak preview on how to approach things in a very complex anticipatory world. So what's the background? Let's start with this one. So in early 2023, I said about a year ago, 1.5 years ago, we were thinking about anticipatory action at Malteser International and ask ourselves a couple of questions. For instance, what does anticipatory action actually mean? Can it be useful for us? How about our partners? And if so, how are we going to do it? So in order to find out, first of all, we started with ourselves. Before going outside, we started with ourselves. And yes, you can switch to the next one. Ask ourselves these questions internally. I did a survey among all the colleagues to find out what's the baseline we're working with. And we found out, actually, we don't know much, but we have lots of ideas. So the decision was quickly taken to get external support to conduct a comprehensive feasibility or scoping study to really understand where are we standing in terms of our starting point, how can we engage in anticipatory action, and what will it entail? What does it actually mean? So you can switch to the next slide. And here, yes, just move on. Yes, we determined, okay, how to go about it. Feasibility study, of course, it has some normal general criteria. You know how it works, you know the drill. The main question we asked, phrased a bit more nicely with a lot of guiding questions and a lot of TORs. But in short, can we do it, and what does it take to do it? So we wanted to determine the added value that Malteser International as an organization has for anticipatory action, but also anticipatory action has for our programs. So it was a twofold way. We discussed it and we quickly found out anticipatory action does not work in a vacuum, never. You have to engage in networks, just like we've heard with the hub and all the other stakeholders involved, because you cannot do it on your own, especially not if you are a rather mid-sized NGO like we are. So we decided to join forces with a consultancy, the GPPI, the Global Public Policy Institute in Berlin. And I'm happy I already saw some experts here on the call as well who were supporting us, and also people who took our questions and joined us on the interview phase. So this is what we did. We engaged the GPPI as our consultant to work with us on a global feasibility study. I come to what it means in terms of methods now. We looked at our whole operations. Malteser International currently is working in 35 countries worldwide with many regional and global projects, and over 100 different projects with different donor bases, with different focus areas. What we focus on mostly, of course, is salt and wash. That's why we're a super active member in this network. But we wanted to find out, how does it work? How does it link with anticipatory action? So what we did, methodologically speaking, was to jointly with our consultants develop an analytical framework for us, tailor-made, how to go about it to start anticipatory action, reviewed our whole organization on a global level. Does it actually fit to what we are doing? Does it fit to our sectors? Does it fit to our focus areas? And to even go much deeper, did 4 case country studies on pre-selected countries. You can see here on the map, Bangladesh, Kenya, Pakistan, and Uganda. 4 countries, as I said, pre-selected because we have long-standing projects there, programs are well connected in the countries, well connected to the national authorities. You have heard you have to talk to authorities a lot when doing anticipatory action. So it doesn't make sense to go into any place where you opened an office yesterday. You might, but we wouldn't. So that is why these countries were selected. And of course, you can also see, guess from the country selection, these are hazard-prone countries, meteorologically hazard-prone. We did not focus on conflict, we focused on hydrometeorological disaster. Okay, and in total, we did more than 200 interviews with our staff, with external stakeholders, with experts on the sector, and conducted a range of workshops and focus group discussions. So the methodological base, you can see, is quite enormous, what we invested in here. And it took us half a year. Now let's come to the interesting part. What are the findings? I will only really scratch upon them and give you sneak previews because we have the study here and I want you to read it for more details. But very quickly, why is it, what we found out for ourselves is very quickly, as I said, starting with ourselves. we found out in a nutshell, anticipatory action is relevant and it is effective for what we are doing, because it links very much to our focus areas and our vision and aims as an organization, and it also aligns with our vision and the future direction that Malteser International is going to take. And that is why the study includes, and we have also published that, you can read that, a roadmap for how to go about with ourselves. It's too small to read here, but in essence, it starts with continue to work on it internally, continue to work on it by yourself, decide if what you want to do, where to focus on, and then go out and network. That is really a brief essence, and how to go out and network comes on the next. So now, interesting part, findings we like to share of all the efforts we took and all the money we invested and all the resources we put into this. You can find in our chapter 1, or as it is called, the finding 1 in our study, starting from page 12. So in summary, what Matthias and Karen have shared, there is a lot of terminology out there. There's a lot of how does it fit into the disaster risk management system. They have shared really nice slides on how does it, where to find anticipatory action. This you can also find in our study. The chapter 1, I promote it a lot because I think it's brilliant to give you a state-of-the-art overview. If you're new to the this approach, or you just want to refresh your mind, this chapter, yes, the study is focused on Malteser International, but this chapter is not. This chapter is a general chapter that gives you a brilliant update on what is out there right now, very up to date. It was published in April, so it's extremely up to date, and provides an overview, giving all the common terminology, linking to what was just said from the Red Cross, what the GFFO is doing, what donors are doing, what other NGOs are doing. Of course, never fully comprehensive. The things are changing fast, but to get this head start, read this chapter and you are almost an expert. You also find examples there, and links as can found on the anticipation of what just was mentioned. And the next finding is also a literature review on the evidence of anticipatory action. We have also heard that there are so many findings out there, so many new frameworks are being established, and that's not by chance, it's for a reason. It's for the reason that it works. We also collected evidence in our study, wrote it down to really build a case why anticipatory action can be helpful and can be useful and can be working also for NGOs. So we also collected examples of other actors because, yeah, we as Malteser, we are not as big as the Red Cross. I can humbly say so. But there is a niche. There is a niche also for NGOs to get started and to work on it. And these examples we have collected. And also, last but not least, it gives you an overview of donor funding and policies that are out there really, really roughly. I snatched a graph from the study. You can see it was raised already in Matthias's slides. Funding is increasing a lot. This is only the GFFO. You can see on the graph, this is what we calculated, our consultants calculated on the study. You can see there is also quite an amount of money there. The last figures are from 2022 and 2021. So what this graph shows you really, really briefly, the donors are also extremely interested in the topic, more in the study. And here is the last one we would like to share, is a step-by-step country guide on how to start in country. Here we link up with what Karen has shared on how to start with the real proper feasibility in country. As mentioned in the beginning, we did 4 case studies, and we are moving now into an exploration phase, continuing on our study with only 3 countries. This is Kenya, Pakistan, Uganda. You will see that Bangladesh is missing now from the list. We started out to do the study in each of these countries, but we are going to explore and pilot. So right now it's an exploration phase we're doing. We're not doing, I forgot to mention, we are not implementing any anticipatory action project up to date within Malteser International. We are still in the phase to follow up on our global feasibility and to integrate these lessons learned and to start by really well networked approaches. We're not doing it by any with the project side, but we're starting with networking. So this is really what I would like to share with you if you're starting with it. Yeah, of course, it's a bit trial and error, and of course, we also have lots of experience in linking topics like preparedness and disaster risk reduction. But what we find out, and what this graph, this really nicely allocated graph you can find in our study, shows is to first of all think about what is there, to go out, check what other actors are there, what Karen mentioned, what other methodological agencies are there, what government is doing, is there an anticipatory action network framework, what is already put on the hub, is the START network active? And once you know all of this, the start finding a niche gets much easier. And this is what we have put here into nice writing and into a very nice way of dealing and getting started. So if you're considering to get started, use this guide. It's really amazing. It's what we are doing right now. If you have questions on it, so I'm just listing the countries here we are working in. I'm not going into detail on them. If you're interested in them, then I'm happy to exchange in even more detail. Can switch on the next slide, please. Yes, there are a few limitations, as I mentioned. We only did 4 case studies, and so other countries are. It's difficult to transfer the findings on others. The research question foremost it focused on MI, but as mentioned, the outcomes are transferable, and many of these steps everyone needs to take. Not everyone needs to do everything. Find your niche, like we are trying. We are finding a niche in WASH and health, our core sectors. We're looking into the anticipatory action frameworks that are existing in each country. And then we tailor our projects onto it. We don't start with the project. We start with the exploration and the feasibility finding. And we talk to all the actors involved, because anticipatory action, and that's my key message, you cannot do alone. And probably you shouldn't, because it's a long-term effort, and it needs to involve everyone working on the subjects from preparedness to post-response reaction. So that's why recommendations can be adapted to other NGOs. I highly recommend to read it, not only if you're an NGO, also if you're a researcher or if you're part of a larger organization. And it brings me to my last slide that provides you the study itself. I have it here in a printed version, but we have a digital, of course. There is a published version. It is a short, abridged version that is publicly accessible, and it includes everything I said on the chapter 1. Brilliant, very nice to read chapter to give you a start into anticipatory action, summarizes everything on the current system, everything, but very fully, mostly. And we have done it also in an internal version, which we're happy to discuss if you're interested more into a particular country or in a particular exchange on how we did it methodological wise. We have it in much more detail in our internal version, and we're happy to discuss it. We cannot share it fully because it also includes some internal findings, but most of it, what we could publish, we published, and you can find it in the download version on the website of the GPPI, and hopefully also on the Hub website. I'm not sure if it's uploaded yet, but it should be. And with that, I finish my brief presentation, rather a sneak preview, or to get you started with anticipatory action. Really a warm call to, if you're haven't done it, then start somewhere and start with learning and talking to others. It's how we approach it and how we feel it makes a lot of sense. Not by head starting into projects, but to talking to other people and identifying niches where you can really add value as local organizations, as national NGOs, as international NGOs. Thank you so much. If there are any questions, I'll be around for a couple of more minutes and then have to leave the call, but my dear colleague Arno is of course available and happy to connect. Thank you so much.
Thank you very much, Rebekka. That was a fantastic presentation. And also, I think, a very good opportunity to share the Anticipatory Humanitarian Action feasibility study of Malteser International, which is helpful for other organizations who also plan to start with anticipatory action, that you can make a quick start looking at all the resources that are available, the limitations, because many agencies might have quite a similar profile, so it will be very useful to share with other organizations. So thank you very much for that. And then, as Rebekka said, that if you have any questions after reading or looking at the report, we are always available to follow up on it and to exchange further on that. And I'm hoping that this also will contribute to expanding the use of anticipatory humanitarian action in our work. Okay, I have not seen any direct questions in the chat, so I would like to propose that we have now a 5-minute quick break, and then so that will be up to, yeah, what is it? No, well, let's say just 5 minutes, and then after that break we will start with a presentation from the Global WASH Cluster Climate Working Group, examples also from the DRC, Cholera related. So enjoy your small break of 5 minutes, and then we will be back in a moment here. Thank you.
Well, maybe you could.
Okay, welcome back, all of you. Let me give you a few seconds to for all people to join in again. So I hope you're all back. It was a very short break, but nevertheless, I think important to do. Okay, let's start now with our next session for about 15 minutes with the Global WASH Cluster Climate Working Group. And we will have some examples from DRC also included. And then there will be also still an announcement coming also about an event that has been planned by the Climate Change and WASH Capacity Strengthening Group. So we have invited Thomas Dechentinnes and Esther van der Woerd from UNICEF, and then later also a contribution from Torsten Reckenzügel from German Toilet Organization to present the example. So Thomas and Esther, are you ready to start your presentation? Okay, I'd like to check if Thomas and Esther are already present there. Thomas, can you hear me? Maybe you can give a sign if you can hear me. Are you there, Thomas? Okay.
I don't think, yeah, I think Thomas is not there. I mean, he is there, but not responding. Maybe we can already start with the next presentation. Octavian, I think you are around.
Yes, I'm around, and yeah, if you can hear me.
Yeah, we can hear you perfectly. Would it be possible for you to take over already? You already shared your screen. Oh, perfect. Thank you very much.
Okay, thank
All
you.
right. Thank you, and sorry I cannot open my camera today because of some anticipated internet issue in Bangladesh. So sorry for that. And hello everyone, good day. I'm Octavian Sarker, working for World Bangladesh. And today I'm here to present on anticipatory humanitarian action in WASH sector in Bangladesh. And let's delve into how we are working to enhance the resilience of vulnerable population to anticipated flood. Bangladesh is one of the most vulnerable countries exposed to many natural disasters, as we already know. And the primary objective of our project is to strengthen the resilience of vulnerable population exposed to anticipated flooding in high-risk areas of Jamalpur district. So there is a map. You can also look at the map to identify the area. And we focused on riverine floods. And if you do not know what is riverine floods, then I can help you. Riverine floods is which occur when rivers overflow their banks. And for this project, with a 30-day of readiness period, 10-day of anticipatory action window we had, and our key actions included community awareness for readiness. And as anticipatory action, we had unconditional multi-purpose cash grant assistance. We provided around 50 euros per households, and upgradation of community toilets and repairing deep wells, aiming to protect 500 households over the targeted areas. As we already heard, this coordination is very, very important component for anticipatory humanitarian action. And I would say effective coordination was the key to our success for this project. And we work closely with local government and mostly with local disaster management committees to engage the communities and identify the project participants and the needs. And additionally, we collaborated with different local, national, and international organizations, including UN agencies, and also with the Start Fund Bangladesh. And we shared our project information with them. And we also shared our accurate knowledge to improve our intervention quality and also to prevent duplication of our services. The project will arrange a lesson learned workshop in the next month. You all are invited. We will try to give online invitation for that as well. And all the relevant organizations will be there of that area. And we'll be sharing our project learnings and our challenges and our best practices. We'll be disseminating there. And we will be also taking the recommendation and feedback from our stakeholders to improve our future interventions. For the humanitarian, anticipated humanitarian action, we definitely have to very, I would say, careful while we select our areas and the beneficiaries. And our project targeted area has a population around 88,000 individuals with a significant portion exposed to flood risks. We conducted a risk and vulnerability analysis, identifying the vulnerable households, and we found 2,700 around, like extremely vulnerable households over there. And our selection criteria prioritized the people with economic situation and women-headed households, households with persons with disabilities, elderly individuals, and families with many children. And we followed the trigger and the contingency plan for flood developed by Start Fund Bangladesh and its partners. And we are also the partner of Start Fund Bangladesh. And readiness actions are triggered 30 days prior to the flood. And while our anticipatory actions were triggered 10 days prior to the flood. And now the most important section, I would say, like problems, initiatives, and impact we have created with the project. So when flood happens, it can be very catastrophic in Bangladesh. If you're not present there, you cannot realize what are the problems over there during the flood. And the floods compromise the safe drinking water and sanitation, making women, girls, children, and elderly and persons with disabilities particularly very, very vulnerable. And during a flood, there will be no access to the drinking water and sanitation. We see an increase in open defecation and consumption of contaminated water that creates health hazards in many of the areas. And during flood, in Bangladesh, one toilet usually being used by many people regardless gender and age. And girls and women usually wait until the dark to use the toilet. While accessing the common wash facilities, often girls and women face gender-based or sexual violence. So how did we address all these issues? It's very important to listen. And we address these issues, first of all, engaging the community members in decision making. So they know better for their families, for themselves. And so the project engaged the community for their decision making. So we focused on specific needs of the community, selecting tubewells and the toilets, and turned them safe, accessible, and gender-friendly right before the flood. We upgraded 20 community toilets and repaired 15 tubewells that met the needs of adolescent girls and women. And we also provided unconditional multipurpose cash grants to 500 households. And for that, we targeted women for the money transfer. And we used mobile money transfer for the cash distribution. And we also had some hard cash distribution because many of the beneficiaries had no mobile phone. Sometimes they do not have the mobile phone banking facilities. And about the impact, like during and after the flood, many people in Bangladesh take loans to survive with the high interest rates and adopt negative coping strategies. And our unconditional cash grant support to 500 households has reduced the debts, and they could buy their required items, including the wash and hygiene commodities during and before the flood through our cash grants. And same time, gender-based violence and the health risks decreased in that region. And also it builds the resilience to flood of the community, the local government, the community-based organization, most cases. And it also helped in the process of strengthening the localization. And I would say now they're very aware of the benefits of anticipatory action over the post-disaster action. And they're starting to acknowledging it. Now the most trickiest part, I would say, the trigger mechanism. So we followed actually the trigger mechanism set by Start Fund Bangladesh. So our trigger relies on Global Flood Awareness System and the Flood Forecast and Warning Center of Bangladesh. And the pre-activation of our readiness action were initiated with a 50% probability of 2 to 5 years return period, plus a rise in water levels. And this happened 30 days prior. And for activating the anticipatory action, we had the trigger of 70% probability and further criteria of rise of the water level and water level flow over the danger level 10 days prior and long. And now we can see flood hazard risk of that area, targeted area. This is Jamalpur district, and Jamalpur district is very vulnerable to flood. And I identified our 2 of the unions we targeted, and this is the Brahmaputra River. And these 2 unions is most vulnerable for floods. And this hazard map usually helped us to plan and target our intervention. And periodically, this map is being updated by Start Fund Bangladesh and their partners and the technical partners like Neuropod. So now I want to share some of the photos of our intervention and activities. So as you can see, our community volunteers are repairing tubewells before the flood, and also some of the facilities like non-functional facilities in the photos. And if you can see our our cash transfer through mobile money is happening. And then we also provided few rescue gears to the union level disaster management committees and our community volunteers repairing the latrines and the tubules. And thank you for your attention. And it's been a pleasure presenting our efforts in anticipatory humanitarian action in WASH sector. And I'm very open to any question you have. You may be, as I already noticed, you may already post it in the chat box, and we are happy to answer your question later on. Thank you.
Thank you so much, Octavian. That was a very nice and short, precise presentation. Thanks for providing us with the insights to your Bangladesh projects. I haven't seen a question in the chat now, so maybe some advertisement for a regional workshop that is going to take place in Bangladesh, basically. Octavian, if you don't mind, I would probably come in touch with you. Maybe you can also participate in that regional workshop that is also being done by the German WASH Network. For more trainings, you can also visit the German WASH Network website.
Sure.
Great. All right. So I learned that Thomas is there. Thomas, are you with us?
Yes, Sebastian. Hello everybody. It's Thomas.
Okay, great. Then I would directly hand over to you, Thomas from UNICEF.
Okay.
Welcome.
Okay, so I will share my screen as well, if I manage.
Yeah, you co-host. It should work.
Yes. Okay. And here, and then share. Okay, and then I will go on Diapo. It's charging, so maybe just bear with me a few seconds. Okay, it says chargement. So I don't know if you see anything already.
We see the word chargement.
Okay.
It's there.
Okay, so thank you for having me, everybody. I'm Thomas Dechentinnes. I work for UNICEF as a WASH coordinator for the cluster at national level. I've been reached to present you an experience we have here as a SERF Anticipatoire, which is more related to cholera response. But last year, I was also doing a little bit of interim as a cholera manager. So this is something I can talk about, and I hope I will be able to answer the question. So I've prepared a short presentation, around 10 minutes, and this is the first slide. So here you see a photo of some water points in Goma. As you know, Goma is being under close conflicts in the area of North Kivu. We have more than 1 million displaced people around Goma, and the water and sanitation needs are huge. So just a photo to show you what's the daily situation around the water points. If we talk about the cholera context, we have 13 provinces in DRC that are notifying cholera cases. So 13 provinces over the 26 overall province. So half the province are not notifying cholera cases. We had more than 20,000 suspected cases since the beginning of the year, with 268 reported fatalities. So what is UNICEF doing as a cholera response and prevention response? We have the CATI teams across the country, especially in the east. As you can see in the map, East DRC is the most vulnerable to cholera disease since a long time already, and the trend is it's not changing, but we have sometimes epidemic alerts inside the country. As you can see, the yellow circle is in the Kasai. Lately, we have also cases in the Kasai. So it's quite a lot of caseload of cases. And through the response, we have reached up to now, since January to now, around 1.7 million people with direct support, which is disinfection, sensitization, and a donation of kits, wash kits. Obviously, the CATI response is also taking care of the surveillance and is also supporting the Ministry of Health for this surveillance. So when we speak about the action anticipatoire, I have to say in French, it's easier for me. We have three scenarios. So first scenario is cholera increase in the endemic province. So it's in the east. Second scenario is external events. Could be flood, could be displacement, something that happens and where the SERF funds is activated. So we can also activate a SERF anticipatoire on the top of the SERF fund. And the third scenario is where there is cases happening in a not endemic area, which is basically the rest of the country excepted the east part. So to activate the funding, we have triggers. For the scenario 1 and 3, we have a certain level of cholera case notified that we need to reach before being able to activate the funds. So we have to monitor in each health zones, and once we have the level 3 for 3 weeks reach, this is like the trigger, and we can then start the fund request. For the scenario 2, the trigger is reached, as I said, when we have a shock, and we also have a self-allocation. So that after the self-allocation has been approved, we can, on the top of the SURF, request a SURF anticipatoire for the like a booster that will come very fast and to serve as a startup of the SURF. So for DRC, in terms of program and activation in 2023, so how does it work? We have a budget of 700,000 USD that we share between UNICEF and WHO. It's 50-50. So each agency received 350,000 USD. Both agencies have their own TDR, and we know how to separate the task in the response, and we have to respond together in the same health zones. So as I said, in 2023, we had 2 launched and implement response following the scenario 2, where we noticed a strong increase of cases and we reached the trigger. We managed then to activate the funds. And we have 1 failed attempt beginning of this year, where we had a lot of cases notified, but not enough to activate the trigger and get the funds. And I will speak about it in the few next slides. This is the first example that was actually December 22, but the response took place in 23. So if you see the graphic here, in year 23, you see the spike. The second spike was the cholera outbreak happening in the sites around Goma. And it was so important that the trigger was reached quite quickly. And there was no need of discussion about it, because it was clearly an emergency situation, and the funds were allocated quite quickly to both agencies. And you can see the impacts highlighted, where quickly, few weeks after the funds received in the cost center, we deployed the team, the Red Cross team, and we had a significant decrease. So we don't pretend to eradicate cholera in this situation. We just want to have the control. So thanks to those funds, we were able to control the epidemic outbreak. So that was the example of North Kivu, which was, let's say, a success. You have to notice, I try not to be too long, but you have to notice that UNICEF got the funds and used it for the CATI response in South Kivu to do like a barrier to prevent cases to reach Bukavu. And the WHO used the funds in the site to do the quadrillage. So that was not exactly the same health zones, but we worked together to prevent the epidemic to reach South Kivu on a higher level. The second situation I want to talk about is in Tanganyika. So it's a different scenario in terms of context, because that happened in the health zone of Kiambi. Kiambi is a health zone which is completely remote, with very few IDPs and less contacts of people and transits, and density of area is low. So we noticed the case where coming from Katanga reached Tanganyika, and we had this spike of cases notified, and we reached the trigger also according to the scenario 2 in a epidemic area. Quickly, we learned from the lesson, which was to have a better coordination between WHO and UNICEF, and we managed to respond together last year, so around June, July, and you see also the decrease, which is quite significant as well during and after the response. For your information, still by now, there's no more case in Kiambi. So we have managed to control and eliminate from the health zones. One comment is the need of more durable WASH. As you understand, there's no durable activities of WASH in the anticipatory self-response. The last case I want to show you is the failure, let me call it this way, because I'm not shy of the word. We had this epidemic in Katanga and Holomami, which are province in the southeast. I just copied and pasted the table so you can see the cases. If you take Katanga and Lomami, you see from week 1 to week 9, we had cases in the province. And we had a big number of fatalities of death. The problem was that we tried to trigger, we tried to convince also the CEF colleagues about the necessity to engage and to start the funding. But because the cases were not exactly as planned in the scenario, we couldn't reach the trigger, and it was decided later on not to start the response with the anticipatory funds. The result of it is that still now we are suffering with the epidemic. It's a little bit out of control, and I think we should have activated. This will be a recommendation in the last slide. I will show you. This is the last slide. So I've tried to come up with a bit of strength, weakness, and opportunity. Basically, the strength is straightforward. It's a good initiative. It's agreed in advance. It's fast to receive the money. The proposal is short and already pre-agreed. We all understand the epidemic context OCHA, SURF, UNICEF, WHO, we do all understand the context. It has reinforced the coordination between all of us, because during the trigger, the response, and the lesson learned, we work together. So it's a good practice, and it works well in remote area such as Kiambi. The weakness is, and this is for me the biggest weakness, is the threshold for triggering is too rigid, and then we were frustrated not to be able to launch the response in Katanga and Olomami, because we were around 1 or 2 cases near the trigger, and despite that, the decision was not to start the response. So I will not read through all the written weakness and opportunity, but basically, if I take a bit of a step back, I think what we should do is to review the scenario and be more human in the decision, because we are so-called experts in WASH, cholera, epidemic, health, public health, and despite that, we still work with very rigid guidelines. I think it's very good to have a trigger, but in some occasion we need to be flexible. So now what happens in the Katanga and Holomami is we are using other funds, but at the same time, you know, we are trying to run behind the epidemic, and we could have kept it under control quicker, so that there would be no cases in the Kasai. No, because the cholera has spread in the Kasai, we are running a little bit everywhere to control it. So in terms of value for money, I think it's much more easy to start quickly. And finally, the opportunity I see here is interesting, I think, to clarify the communication chain, because it was a little bit confusing here, who to contact and how to, let's say, get together quickly under the lead of who. Is it WHO? Is it UNICEF? Is it OCHA DRC? Is it OCHA New York? Is it other people from the CEF? That was a little bit confusing for us, and it led us to having some delay in communication. So if we want to be fast, better to have a very clear communication chains. And then, of course, because I'm WASH, I would say that we should include a little bit of WASH, like rehabilitation of water network, rehabilitation of drilling boreholes, you know, just to leave something behind when the CATI teams are going away from the response. And my last, my very last comment is the Anticipatoire is good for the remote area, but is not appropriate for the urban and large RDP site, as the fund is too small and the CATI approach is not the best. We should really have some Anticipatoire funds for WASH, where we could improve the real basic WASH access. Of course, I said that with my hat of WASH, but this preparation was also taken from my 6 months as a cholera manager. So I mix a bit of both. That's it from my side. I don't know if we have question times or maybe later, but over to you guys.
Thank you, Thomas, for this very interesting scope into the big project and implementation of the Global WASH Network, specifically UNICEF in this case. I think it's really interesting what you mentioned about the lessons learned. Karen also mentioned in the beginning how the cycle is going. So you are at a different stage than, let's say, other organizations. So it's very interesting to see a bit of this iterative process. I don't think we have time for questions immediately. I think there are some in the chat, but I will say a warm welcome to Thorsten. So because Thorsten will introduce us to an exciting opportunity in upcoming future.
Thank you very much, Lorenz. Can you hear me? Works?
Yes.
Okay, and you should also be able to see my screen now.
Yes.
Okay. Okay, great. Yeah, just a very brief input. My name is Thorsten from the German Toilet Organization, also a member of the German WASH Network. I'm now here as representing the climate change working group of the Global WASH Cluster. I'm a co-lead there. First of all, I would like to thank the German WASH Network for partnering with the climate change working group of the Global WASH Cluster for today's webinar. There's a similar cooperation planned for November for FSM and climate. And today, but now I would like to announce on behalf of the climate change working group a webinar. So if you are interested in learning about existing tools, resources to support you to better understand and address climate change and WASH, please join our webinar conducted on 19th September. During the webinar, we'll launch the Climate Change and WASH Capacity Strengthening Toolbox. And if you would like to join, you have either to use the QR code or to register under this address here. I can also share the link with the address in the chat. Okay, perfect. Should be sent, isn't it? No, it is not. Now it should be, yeah, okay. Now you should be able also to copy the registration link. And that's already all. Thank you very much, and over to Lawrence.
Thank you, Thorsten, for this quick outscope for future opportunities. Being conscious of time, I would like to ask Karen for the last presentation. Karen, can you? Yeah, I can see you, and I can.
Yes, I'm happy
you should be able to
stop sharing, then I can share.
Yeah, Thorsten is still sharing.
No, not anymore.
For me, you are still sharing.
You're right. Okay, sorry.
Now Karen can take over. Thank you, Karen.
Amazing. Okay, let me share my screen. Can you all see my screen? That's fine.
Perfect.
Yeah, okay, great. I would just want to give you a brief example of the work that German Red Cross has done with the Mozambican Red Cross on floods. And so I'm going to briefly present you the early action protocol for floods in Mozambique. As I've said in the introduction, right, when we're talking about health or epidemics in particular, there's these different approaches. And here we would see one example of how we address epidemics or health-related issues through an early action protocol or anticipatory action plan that is related to another hazard. So basically, we're addressing secondary hazards from these floods. The flood EAP, the flood early action protocol in Mozambique, has been activated in 2020 and 2022. So there has been quite some experiences, but I will just broadly walk you through, okay, what are the health-related activities there. Whoopsie. Okay, so very briefly, floods in Mozambique. You can see on the right side the high-risk flood zones. The EAP, the early action protocol, is in general, it can be activated in 4 different river basins, so in the 4 large river basins, which is at the same time also a challenge because in terms of readiness, that means that you have to, you need volunteers to be trained throughout the whole country. So it's quite a logistical challenge where we also sometimes, we really need to rethink how we do it. So sometimes it's also maybe advisable to think smaller than too big. But I mean, generally, what are the main drivers of floods in Mozambique? On the one hand, it's tropical depressions. So I mean, Mozambique being cyclone prone as well. And I mean, yeah, those cyclones tend to bring a lot of water as well. And then we have prolonged rains. Major impacts, I don't think they come as a surprise, is impacts on lives. So people actually really lose their lives still due to the floods. Impacts on housing, impacts on agriculture, impacts on health, and impacts on the general economy, especially because they happen like quite regularly, the floods. When now we look at the Mozambique Flood Anticipatory Action Plan, in their plan, they have prioritized 3 main impacts. The first being loss of life, the second one being the outbreak of waterborne diseases, for example, cholera, but not specific to it. And then the loss of important assets, which is like different documents. So people like in the past lost simply their birth certificates, their social security ID, and so on. So that is one of the things that was also happening. The trigger is very simple. It's simply based on a 5-year return period, and once that threshold is reached, so basically a flood that occurs every 5 years, that is basically the trigger level. That is of course then different for different river basins. The flood level. We have a lead time of only 3 days, so 72 hours. And in our case, just to say, our anticipatory action plans have a lifespan of 5 years, and either those, within these 5 years, the plan is activated or it can be renewed. But that is in generally, we have the plan ready for 5 years to be activated. Now, when we start on the right again, what are the early actions that are to be implemented in the 3 days? Again, 3 days is not a lot, especially when we think about the logistics and the vastness of the country. One is awareness messages, so that is awareness raising through radio, TV, but also megaphones through the volunteers in the communities. They distribute mosquito nets, chlorine tabs, buckets, and mugs. So very simple, wash kit distribution in that sense. And they distribute the means of protection for documents. And as I said in the earlier presentation, there are readiness activities that are done when we have a plan in the Red Cross movement. So here they do annual EAP training workshops for staff and volunteers. They do like regular simulation exercises. And then in terms of the prepositioning, so everything that is already bought and put in the warehouses until it's activated, they prepositioned already the equipment for volunteers, that is boots, raincoats, t-shirts, and so on. The mosquito nets are prepositioned, and then the chlorine tabs, as well as the buckets and the communication awareness material, as in the megaphones and the whistles and so on. These are also already prepositioned. So basically, once the trigger is met, these things are just taken out of the warehouse and then being distributed. I don't need to walk you in detail through that. You're way more experts than I am, but flood impacts on health are due to the destruction or pollution of boreholes and open wells. So contents of latrine pits and garbage areas float in the flood water. And then we have an increased risk due to standing water. So that's a bit the situation, which is then why it was decided from the Mozambique Red Cross to distribute the water purification material, the buckets and the cups, together, of course, with instructions on their use and the distribution of mosquito nets. One could argue that this could be done either, it could also be done at evacuation centers if people evacuate. But the logic is also that a bit to think about, okay, if I distribute this before people even evacuate, then people, of course, it's always recommended to go to evacuation center, but sometimes people have their reasons not to go. So they could also take these things wherever they go. So it's a bit like the idea of, okay, we give people a choice, and wherever they are evacuating to, they have the necessary means to at least access clean water and be safe from mosquitoes. As I said, the prepositioning and readiness, so the different items that are prepositioned in regional and provincial warehouses. So basically, we distribute them throughout the country a bit in order to ensure that we can the material can be brought to the respective place as fast as possible. We have the refresher trainings and the simulation, as I already said. I just want to give you maybe some considerations when thinking about your own activities, because I think the activities that are done are not groundbreaking, right? This is like very basic things to do, but on the other hand, what is the capacity on your organization? I think that's also always something to think about. And at least the Mozambique Red Cross, they are working a lot on especially community health. So these are activities that fit into their mandate, but also into their capacities. And I think the second thing is also that they have done these activities already as response activities. And that can also be an advantage, right? Because anticipatory action is so new for many organizations that sometimes it's also good to do activities and think about, okay, are these actions actually perhaps more impactful if you do them before and if you do them after? And in that case, it was decided yes, because then people, you know, then people don't even get sick from the first place if they have the clean water before. So it's actually good, right? It's a win-win situation that you can do activities where you already have experience as response. Now you need to do them faster and earlier. That is a logistical challenge, but that, you know, that you don't have to reinvent the wheel in many cases. You just need to maybe reorganize your logistics and your SOPs according to that. Yes, I talked about the mandate of the organization already. So thinking about like what can you do? Because in Mozambique, for example, there are simply some activities that are outside of the scope of the national society, and also maybe some actions are not allowed. So cash, for example, we cannot do because it's simply not part of the. It's simply not allowed by the government as of now. And then, yeah, you also need to think about what is the capacity of your organization. We talked about it, but also the local government and the communities themselves. So what is it that they can also absorb and do in the given time? So, I mean, if you give them cash 3 days before, it's difficult, right? Because people should rather be evacuating than going to a market and spending that cash. So I think there's lots of considerations. And lastly, one consideration is non-regret actions. And I think that is, I mean, pretty obvious also in the WASH case, is that, you know, you distribute water purifier and no harm is done with that. And people can, even if they don't use it in that moment, they can use it later. Yeah, and I think that's it. This very small and brief overview of what's being done in Mozambique. Generally, again, I would really recommend to go on the working group of the AA and Health working group, because it's, yeah, this outline of the different approaches, I think, could be very interesting for many of you. And I'll stop here.
Thank you very much, Karen. That was a very nice presentation with a lot of details on how anticipatory humanitarian action can work in practice. I think very important for us, also with the links to the WASH activities. And then, yeah, we have now more or less in this webinar, we have tried to introduce the topic of anticipatory humanitarian action, explain it a little bit what it is. And then we have seen how agencies like Malteser International did feasibility studies to see if it's possible to organize or to implement it in their organizations. And that can be shared also with other stakeholders or other organizations. And then we saw the very good presentations and examples from UNICEF, from Congo, from Bangladesh with the flood. Flood is often a key aspect to look at more and more with climate change. Also, if we look at our WASH activities, and then also now these activities from the German Red Cross are really an enlightenment on how anticipatory humanitarian action can be implemented. So that was yeah, more or less for us from German WASH Network. That was our goal also to lobby a little bit more for knowledge on this anticipatory humanitarian action and get more people involved in it. And we're happy we can do that so with our WASH sessions, supported by the German Federal Foreign Office. So thank you very much for that. We will have more WASH sessions like this one coming up also in the near future. So that will be good for all of you to note. And then in the near future, you can see it on the website and also register for there. I see already a link putting up by Lawrence there. So there will be a session on more also disaster preparedness related. And then with a focus on East Africa. I saw many participants also from East Africa in this session, and it's focused on drought, floods, but more on the disaster preparedness perspective. And another one on fecal sludge management. That are two WASH sessions that are coming up that I highly recommend on people also to join in if you're interested in that. Then I like to thank all the speakers and contributors to this session. I think it was wonderfully prepared and presented and very clear. And also thanks to all participants for participating in this event. Unfortunately, time is a little bit limited. We are already 1 minute over our scheduled timing. So we have noted down all the questions that are in the chat, and we will assure that follow-up will be done also with the presenters, that those who post questions in the chat will get direct answers individually from the people involved in that. So again, let me also thank my colleagues here at the German WASH network who were involved and participating in this. And yeah, then let me see. I think I mentioned everything. So yes, thank you all of you. You will get a link with the resource documents also shared, so all the presentations will be available. And yeah, we are committed to continue on working and supporting on anticipatory humanitarian action, and highly recommended also to link up with the networks that were presented. So if there are no further comments from my co-presenters, co-facilitators that I might have forgotten, then I would like to close the session here. So thank you all very much and have a nice day. Bye-bye.
Thank you all.
Thank you.
Bye.
Thank
See you
you.
soon.
Bye-bye.
Thank you. Bye. Thank you. Bye.